UC Regents Board is meeting right now, and they are getting a lot of backlash regarding a potential collaboration with Dignity Health. KPIX 5's Jackie Ward explains why there are concerns about this partnership among the LGBTQ community.
147 people signed up for public comment. That's a record. They spoke for more than an hour, and a lot of them were against the potential partnership with Dignity Health.
From transgender students and employees to those who may seek reproductive care like contraception, abortion care, and HIV prevention medication, it would be unconscionable to limit their access to medically necessary and in some cases life-saving services.
And for this hospital to cancel my necessary and important health care based solely upon who I am is painful beyond any comprehension.
Evan Minton, a transgender man, was just one of the people who spoke out against UCSF possibly teaming up with Dignity Health. He says he was scheduled to have a hysterectomy at a Dignity Health hospital until his health care provider learned how he identified himself.
Your transgender students will get lost in the system and wind up at a Dignity Health hospital, resulting in harmful discrimination just like I did.
Dan Diaz was here as an advocate for end-of-life options. His wife, Brittany Maynard, took medication to end her life in Oregon in November 2014. He says he fears what a relationship with a Catholic hospital organization will mean for UCSF patients.
My wife had to leave the state so that she would have this option. It would be shocking if now in a state that has passed medical aid in dying, where a patient would not be able to have these conversations and pursue medical aid in dying here at UCSF.
But Lynn Ames, a registered nurse at UCSF, is for the collaboration.
The ability to deliver care is complicated by the daily challenges around the need for more space, more beds, and more operating rooms.
Dignity Health says it already partners with UCSF Health on many services and that it has a track record of providing high-quality, evidence-based care. Our services are available to all people regardless of background, ethnicity, gender identity, or sexual orientation. The UC Regents chair, George Kiefer, is the only one allowed to talk about what transpires here at this meeting, and we were unable to reach him for comment. John Perez becomes the new chair tomorrow. At UCSF Mission Bay, Jackie Ward, KPIX 5.